Was CFS initially ignored by healthcare professionals? Imagine experiencing relentless fatigue that no rest seems to fix, along with other puzzling symptoms, and feeling like your concerns are dismissed. That's been a common story for many with chronic fatigue syndrome and myalgic encephalomyelitis. When these conditions first emerged as distinct illnesses in the 1980s, many healthcare providers were skeptical or simply unaware of their seriousness. The history is complex but revealing about how medical understanding and recognition have evolved over time. Long before the name chronic fatigue syndrome or myalgic encephalomyelitis was used, similar illnesses appeared in medical records. In the 19th and early 20th centuries, doctors described conditions like neurasthenia, atypical poliomyelitis, or epidemic neuromyasthenia. These terms captured symptoms like fatigue, muscle weakness, and neurological issues but lacked clear definitions or understanding. Because of this vagueness, many of these cases were poorly diagnosed or dismissed. In the 1950s, an outbreak at the Royal Free Hospital in London drew attention to what was then called benign myalgic encephalomyelitis. However, controversy arose when some psychiatrists labeled it as mass hysteria, dismissing the physical symptoms and suggesting psychological causes. This attitude reflected the broader skepticism that surrounded the illness at the time. It was not until the 1980s that the condition gained wider recognition in the United States. Outbreaks in Nevada and New York were linked to Epstein-Barr virus, leading to the initial label of chronic Epstein-Barr virus syndrome. But research soon showed that the virus was not the sole cause, and the illness remained poorly understood. In 1987, the Centers for Disease Control and Prevention formed a working group to define the illness more clearly. They recognized that it had been called many names and was often misunderstood. In 1988, they introduced the term chronic fatigue syndrome as a neutral, inclusive name to help legitimize the condition. Despite these efforts, early research was met with skepticism. For example, a 1990 study suggested a viral cause related to retroviruses, but the findings were largely ignored or refuted by the CDC. The diagnostic criteria in those early years were broad and vague, making it hard for doctors to diagnose or research the illness accurately. This vagueness sometimes led to misdiagnosis or patients feeling dismissed. Throughout this period, many healthcare professionals doubted the legitimacy of ME and CFS. Symptoms like fatigue and pain were often attributed to psychological factors or hysteria, rather than recognizing them as signs of a real, physical disease. Patients frequently felt ignored or told their symptoms were all in their head, which delayed proper diagnosis and treatment. This stigma created a barrier for many seeking help. Over time, however, research and advocacy helped shift perceptions. By the 2000s, major health organizations like the Centers for Disease Control and the National Institutes of Health began to acknowledge the seriousness of ME and CFS. Diagnostic criteria were refined to include key features like post-exertional malaise, cognitive issues, and unrefreshing sleep, reflecting the complex nature of the illness. The 2015 report from the Institute of Medicine, now the National Academies of Sciences, emphasized that ME and CFS are real, multi-system diseases. They even proposed a new name, systemic exertion intolerance disease, to better describe the core symptom of post-exertional worsening. In summary, yes, for many years, healthcare professionals largely ignored or dismissed ME and CFS. This was due to limited understanding, vague diagnostic standards, and stigma around unexplained symptoms. But as research advanced and patient voices grew louder, recognition improved. Today, ME and CFS are acknowledged as serious, complex illnesses that requiring proper medical attention. This history underscores the importance of ongoing education, research, and compassion in healthcare to better serve those living with these conditions. Always remember to consult healthcare professionals for personalized advice and treatment options.